Good afternoon. I'm Nabeel Mohammed. I'm an associate professor at the Electrical and Computer Engineering Department at North-South University. Our idea is called Meno-Chat, which is an assistive chatbot against menstrual problems and to promote menopausal healthcare for women. The idea is rooted in something extremely simple, which is if we can provide information, then women can be empowered to go and seek the proper healthcare or the proper support that they need. Yeah. Sure. So it's really, there are many studies that simply show that as women become more educated or as they're better informed, they actually gain access to better healthcare services. So it's a very simple approach to provide healthcare services backed by technology. This is, unfortunately, in this country, a topic which is quite sensitive and does not necessarily engender open conversation. So our idea is to simply use machine learning-based systems, because that's where my research background comes in, where we will essentially try to develop a neural network-based dialogue system. The only difference with something which is popularly that we see now with ChatGPT and other systems is instead of our system being based on pure training data, we would like our system to be rooted in authoritative information. It's very, very important that the information that we provide is actually correct, is relevant, and is also up to date. It is financially very difficult to always retrain our models every time there's a new piece of information. So we do need to make it financially scalable as well. So this neural network-based approach is going to be something which is rooted in authoritative data sets, and the neural network is essentially going to be trained to get the relevant information from the databases and to present it to the audiences in the right empathetic way. Of course, it's no use trying to just create a system where people are going to sit down and type all the time. That I don't think necessarily works in this country, considering the audience. So the actual interface is going to be multimodal in many ways, where we are expecting at least 3 types of interfaces. So of course there could be a mobile phone application where someone can type and interact with it. Someone can speak through the app. But the other thing that we'd like to do is maybe create some kind of hotline where someone calls a number and can interact with the dialogue system. There's a study design given here, but ideally what we'd want is, the challenges are many, of course, but the advantage is we do have, the information exists. It's a matter of working with that information, transforming it to the correct Bangla form, then of course going through the entire process of training these neural networks. We do have challenges with speech recognition, but it's one of those things with this type of project where if we start, we will get there. And this is a great place to start. It's something that has obviously an immediate impact on society. This is something which is domain constrained, which also makes the machine learning part of it more tractable. And we hope that the initial proof of concept is going to be effective, inshallah. Thank you, everyone.